1, 2, 2, 3. 1, 2, 3. In the place to be. In the place to be. Right, check.
On behalf of Hudson Guild, it is my sad honor to welcome you all here for this important community meeting. As Yetta Perlin will explain in 1 minute, the point is to hear and be heard and move forward as a community about the issue of a hospital here for this community. It is again my honor to present Yetta Perlin.
Makes me very angry. There's a lot to be said about St. Vincent's. I think all of us have stories over the last few weeks. I've got to hear many of those stories in the process of our lawsuit, the organizing to try to stop St. Vincent's from closing. And April 30th, 2010 is a very sad day for us here on the Lower Manhattan. There are 3 things that we would like to achieve today. First, I just want to stop and take a moment, if we could recognize and thank Assemblymember Glick and Assemblymember Godfrey for taking the time There are 3 purposes that we had in putting this meeting together. The first is to give you, the community, a chance to get some answers. You know, one of the things that has been so painful for me, and I'll talk in a little bit about how I got involved in this around-the-clock fight for the last 3 weeks to try to save St. Vincent's Hospital, is that the public has been absolutely shut out of this process. Right? And we need to hear your voice. It is beautiful to see literally hundreds of you out here on a Friday night, on a beautiful day, on a weekend, to talk about what we need to talk about as a community, which is the public health and safety of our people. And the first thing I want to do, each of us are going to speak for a few minutes, maybe 5 to 7 minutes. We're going to try to keep it short, although there's a lot to go over, because the biggest focus of this evening is to listen to you, the community. And I believe that the answers lie in us as a community. I think that we have the solutions, and I don't believe that we have had the chance to be a part of that solution yet. So that's the main focus of this evening. And I also want to ask you, on each of your seats, there's a little handout. And on the front of it, it talks a little bit about urgent care versus emergency care, which we'll talk about later in the evening. And on the other side, there are a bunch of phone numbers, and there are a bunch of addresses, and there are even some model letters. And there's paper up front here today. We're going to pass that paper out, and we ask each of you tonight, before you leave, to write a letter to Governor Patterson and to Mayor Bloomberg and to Commissioner Daines to make sure that they understand that we are coming together as a community, and we will not stop until we have a hospital for the Lower West Side of Manhattan. So before we get started, I just want to give a really brief bio of some of the people who are going to speak tonight. And basically, I'm going to try to give an overview of kind of the last 3 weeks and the last couple of months. We've put a chart together here with a timeline that I'm going to go over with you that I think is meaningful, and I'll try to explain what's important about that. And then Tom Shanahan is going to go over some of the myths and truths of St. Vincent's. He's put together a PowerPoint presentation and pick up on some of the things that I missed. And then we have Dr. Kaufman, who's going to talk about kind of the difference between urgent care and emergency care, and why we need a hospital, for there to be emergency care. And next we'll have Eileen Dunn, who is an RN, and nurse at St. Vincent's, talk about how the community, separate and aside from emergency care, how the community really needs a hospital and the complex network of healthcare that a hospital provides, and is really diffracted with the closing of this hospital. And next we will hear from Miguel Acevedo, who will give us an update on the West Side Neighborhoods Alliance and the recent rally last week, and some of the work that he's been doing as well. And finally, we will hear from Jay Callio, who is one of the plaintiffs in the lawsuit, and a community member and a patient at St. Vincent's. So let me just start by giving a very, very brief bio of the panel, and then also we're going to hear from Assemblymember Glick, and then Assemblymember Gottfried as well. And then we'd like to turn this over to you, the community, as a chance to ask questions, to give comments, suggestions, solutions. You'll have a 2-minute time limit, and we just want to hear from you for most of the evening. Okay, so first the bios. Dr. David Kaufman is a primary care doctor, a general internist, and HIV specialist in practice at St. Vincent's Hospital for over 30 years. He came to St. Vincent's Hospital as a medical student and never left. He was a senior vice president in 2000, right after the merger, and stayed for 18 months. Then he became the chief of ambulatory care and medical director at the Spellman Center for HIV Disease at St. Vincent's Midtown. He also has an active private practice and has been involved in medical student and resident teaching, and is the medical board and a representative of the medical staff. Eileen Dunn is a registered nurse who has been practicing at St. Vincent's for over 2.5 decades and is fight, by the way. A role model and a hero, yeah. She says, as of today, she is unemployed. She was assigned to the medical surgical unit at the St. Vincent's and heads up the Nurses Association of St. Vincent's Hospital. Tom Shanahan is a civil rights attorney, a longtime community activist. He was crazy enough to say yes when I asked him if he would help me with the daunting task of trying to stop the clock on closing St. Vincent's and fight Albany and the powers that be to ensure we have nothing less than a hospital on the lower west side of Manhattan. And Tom hasn't slept much in these last few days of things as well. Miguel Acevedo is a community organizer and runs the Fulton Youth in the Future, and is the Tenants Association president of the Fulton Houses, a longtime resident in the area. He's been working steadfastly to stop the closing of St. Vincent's Hospital and to ensure emergency care for the community, and he has also filed a suit to help ensure this. Hopefully we'll get to hear about that. And finally, Jay Callio is a longtime resident of Chelsea, has worked as an EMT as well as doing medical writing. He's one of the plaintiffs in our action to try to compel the Department of Health to ensure proper oversight of St. Vincent's and to ensure a hospital to adequately provide for the public health and safety of our community, which we believe is a compelling and constitutional state obligation.